we knew that the situation in the 50s and the 60s was, and still today, look at that, heroin, psychedelics, drugs. That was a major, major issue for a smaller country in the 50s and 60s. And so look what they did as prevention strategies, you all. What I just told you earlier was not effective, right? Look what they did with heroin. They tried to do scare tactics. They did do education, but they tried to do scare tactics through films. And that's the only way they did education was through film. So if you couldn't afford to go to a movie theater, guess what? You weren't getting the education, right? Or if you were trying to get scare tactics and that was supposed to prevent you from using heroin in the 50s, then it wasn't at all very successful. And look at the 60s. We were using those sort of those psychedelic drugs, those LSDs and all that stuff. And the only prevention strategy that our lead government was focusing in on was, let's scare the heck out of them. If you use this is going to make you so crazy, you ain't going to know what to do. So let's just scare them. Okay? That became the historical way of prevention in those 2 decades. Okay? In the 70s, the 80s, it was, you know what? We can't scare them. So let's offer alternatives, things that folks can do, maybe some athletic stuff or some ways of doing things separate than just always wanting to have idle time on their hands. Let's offer them something else. Let's move them into another direction. And even what we started seeing, one of the president's wives was saying, just say no. That was prevention back then in the 80s. I think President Ronald Reagan's wife, Nancy Reagan, if you ever get a chance to Google the Just Say No program, that was a huge, major, using taxpayer dollars to really look at that piece. But for the first time though, for the 70s and 80s, y'all, alternatives was that first step in moving in the right direction, okay? But the Just Say No program brought it back to a swing again, because just saying no is not an effective program. It didn't have no effect on communities, on individuals, on broader communities, okay? We also know that in the 90s, there was an increasing emphasis on, hey, let's just don't do one prevention approach. Let's do a comprehensive prevention approach. And this was when the time when I was just starting, that let's look at some of the approaches I'm about to show you all in a few minutes. Let's do more of a comprehensive stuff. Let's study Tracy's himself. Let's study his friends, the neighborhood he lives in. Let's study the family that they're coming from. Let's study that whole community in which that might need a broad-based environmental prevention strategy, okay? And saying, if we can attack it multiple ways in a comprehensive way, and then just using one tool, we have multiple tools that we can use. That's good prevention. So now the research was coming towards saying using multiple strategies over time can have an effect. And that was early research was starting to show that that's a true methodology. And then what came was this whole idea in the 2000s, and as of late, the 2010s, and as we move into the 2020s, now that we needed to understand this whole connection between substance abuse and misuse and what else? Mental health. And that's when I went to work at SAMHSA in 2005 and 2006, moving away from, we kept the comprehensive idea, right? But also we knew that mental health was important because it allowed Tracy, as an example, to make a decision if he's feeling good about himself. If he's dealing with anger, if he's dealing with anxiety, if he's dealing with depression, early depressional signs, chances are Tracy may decide to be influenced to use some sort of substance to sort of blend and soften the blow of his or her mental health issues of anger, anxiety, or depression.